All right, so this is just a description of Medicaid enrollees and service use. So one of the things that we talked about, we listed eligibility categories. This is just going to give you a little bit of a picture of what things look like as you're looking across states. So the big picture is that over 78 million individuals were enrolled in Medicaid and CHIP in the 50 states plus Puerto Rico that reported enrollment data for November 2020. Of those, most were enrolled in Medicaid, but 6 million were enrolled in the Children's Health Insurance Program. So the enrollment as a percentage of the US population. So it's another way of kind of understanding this, like what is the share of the population of the US? It's kind of captured by Medicaid. And so the estimates based on this, we have 86% ever during, sorry, I'm not sure on the, this slide was not put together originally by me. I believe this is in millions up top, and then we have a percent down below. Okay, so Medicaid enrollees ever during fiscal year 2018, 86 versus 74 million. CHIP enrollees, as we mentioned, we're talking about roughly between 6, but also if you're looking at ever enrolled during fiscal year 2018, that's up to 9 million. So you note that, for instance, people, if they're enrolled at some point, that doesn't mean they necessarily stay enrolled in these programs. Totals for Medicaid and CHIP, so ever 96% or 96 million, and at some point in time during at a single point in time 81 million in Medicaid and CHIP total. Let's see, and then in the calendar year, the other thing I would say is the calendar year is different than the fiscal year, and so of course that means you're going to have a different estimate. And so if you're looking at one point in time in a calendar year, we've got 55 million. And so again, the differences in kind of sustained enrollment in these programs compared to something like Medicare are fairly large. Now, if you look at the Census Bureau data, the overall US population, you're looking at 320 some million. And so in terms of the percentage of the US population, you're looking at, depending on when you look or how you look, somewhere between 17 and 29% of the US population is enrolled or has been enrolled in Medicaid and CHIP. So again, looking at, if you take a snapshot in time, we've got 18% of the US population enrolled in Medicaid and CHIP in 2018. The percentages, however, by state range quite a bit. And again, you want to think about this doesn't necessarily just relate to income or needs of the populations, or the eligible populations, I should say, but also you could think about state program differences and waivers and other things, how states administer enrollment. So there could be a lot of different reasons for the range that we might see in the percent coverage in a state. Right, and it may reflect certain differences demographically, but it can also represent differences. Certainly, can represent differences policy-wise. Program growth has been fairly substantial since 1999. We have fiscal year enrollment, fiscal year end enrollment in millions, and spending in billions in the line. Right, so the columns get us up to, by 2018, we have, again, over 70 million people enrolled and up in the $600 billion mark in terms of spending. So there's just been a lot of growth just in the last, 18 to 20 years. Medicaid expansion enrollment. If you think about total enrollment, there's a difference between saying total enrollment and which groups you're talking about, right? So you've got total Medicaid enrollees have gone up, but if you think about the expansion group who are newly eligible, and the different categories that we see, the growth in what we're seeing, a lot of that is through this kind of Medicaid expansion in these years between 2014 and 2019. So when we say the Medicaid program has grown, that's not necessarily a homogeneous growth rate across all eligibility categories. We have broad enrollment groups at the beginning and the end of the expansion. So these are just very broad. You could break these down into more specific eligibility. So for instance, when you say adults, does that mean childless adults or parents? But these are just very broad categories. So if we break this down into people who are older, disabled, right? So those are relatively smaller chunks, but then you look at adults who are either eligible because of pregnancy, parenthood, or low income or low income, and children still remain the largest part in terms of enrollment. But we have seen that growth in adults since 2014 into 2020. Per capita spending is highest among people who are older or who have disabilities. Some of the lowest is among children and non-expansion adults. Expansion adults are also fairly low down there, but we do see that per capita spending being somewhere around 5,000 up through around 30 or so thousand. We have the distribution of Medicaid benefit spending by eligibility group. So if we think about all enrollees, so that's across all of these different eligibility categories, which may or may not be a useful thing, but you could think about where that spending is happening program-wide, right? Large chunks of that are in managed care, which of course covers a lot of different services. Long-term services and supports, both institutional, meaning typically nursing facilities, and non-institutional, which might mean under waiver programs, for instance, for home and community-based services, are also fairly large. You also have non-hospital acute, and so for instance, emergency department care, and inpatient and outpatient hospital costs also being fairly large. But when you look at different eligibility categories, there's a lot of managed care spending, pretty heavy, when you're talking about children and adults. When you get into disabled and aged populations, of course, you're talking about long-term services and supports being a pretty large chunk of the spending that's happening for those groups, well over half. The average cost, enrollment, and expenditures by beneficiary category. So children represent a large chunk, as we saw, of Medicaid enrollment. That's the bottom bar there, so 40%, but only 19% of Medicaid expenditures. Similarly, adults, these are non-expansion adults, I believe, represent 22%, but again, a smaller share of the costs. Expansion adults are a little closer. You've got 16% of total Medicaid enrollment and 12% of Medicaid expenditures. But of course, when we get to persons with disabilities or people who are 65 plus, that kind of flips, where now you've got relatively smaller proportions of Medicaid enrollment. You got relatively smaller portions of enrollment and relatively larger proportions of Medicaid expenditures, to where those two groups together are accounting for more than half, for instance, a little more than half of the expenditures, while they are less than a quarter together of Medicaid enrollment. So the expenditures that we see are different by groups and are not proportional to the amount of the enrollment that these groups account for. There are certain populations, of course, where Medicaid is just absolutely vital. You've got percent with Medicaid coverage. So at the very top, we have non-elderly who are below 100% of the federal poverty level. The percent of those individuals with Medicaid coverage is 61%. And we have non-elderly between 100 and 199% of the federal poverty level, so still low income, 43%. And note, for instance, just to take a minute to say this, non-elderly below 100% of the federal poverty level. So these are individuals who have very low incomes. There's still, almost 40% of those individuals who are not on Medicaid. Now they may be covered under some state program or something else, but just to note that there is still a sizable percentage of people who do have very low incomes and are not covered by Medicaid. We have, if we look at families, all children, Medicaid covers 38% of all children, but children who are below 100% of the federal poverty level, note that the gap there between all children who are below that income level and children who are enrolled in Medicaid is a little smaller than, say, the overall gap for non-elderly. So the 83% of children below that 100% of the federal poverty level. Parents, and one thing I think is really important to note is that, births, almost half of births are covered by Medicaid. And so that's just, I wanted to note that's just a really large part of what this program does. Seniors and people with disabilities, Medicare beneficiaries, 19% also have Medicaid coverage. Non-elderly adults with a disability, so almost half of people with Medicaid coverage. Similarly, non-elderly adults with HIV and regular care also. And lastly, nursing home residents, 62% with Medicaid coverage. So as a summary, in the United States, a sizable portion of people in the United States receive Medicaid benefits. It's estimated that 1 in 5 US residents from the American Community Survey. Children are the largest single enrollment category, but remember that they are not anywhere close to the largest amount of expenditures. The largest share of service spending is for beneficiaries with disabilities, and I would also add that people who are 65 plus, just remember that while they are a smaller category and their expenditure category is also small, it's flipped compared to children, where it's a smaller group percentage-wise of enrollment, but larger in terms of expenditure than its proportion of enrollment. Do we have any questions?
So let's see, we have one question. Let's see here. I apologize. Well, here's the most recent one. Do you know if the births category covers babies with intensive care needs, where eventually Medicaid kicks in?
It should. I mean, that's, for instance, that's most of my work is in the expansion adults category, and so I'm not a Medicaid birth researcher. Everything I know about the program would say that it would, but that's something we'd have to check for you. So, like reaching out to ResDAC separately would probably be a good one to check if you're thinking of, making a data request.
Yes. And then are children below 100% of the federal poverty level also eligible for CHIP?
Yes, I believe so. I'd have to look at the rules for CHIP. I believe so, yes.
All right. And can you briefly describe what is meant by managed care organization? Like, is it insurance companies?
Yeah, good. Yeah, sorry. Yeah, it's a very good question. So a managed care organization, a lot of times these are, so I'll give you an example of the work, and you'll see this in our applications tomorrow. The managed care organization, or the accountable care organization that we were working with was so I say accountable care organization, but that's a partnership between payer and provider systems. So the payer system was a county managed care organization. So when I was talking to the managed care organizations administrators, they were county employees. But you could also see, for instance, private health insurance companies taking on managed care contracts. And that's, I would say, probably the biggest chunk of what I would see around would be private insurance companies taking on contracts to administer the managed care to act as the managed care organization. So the biggest chunk of what you're going to see are those, and they operate through managed care contracts similar to what you would see in Medicare managed care. And then again, what they're responsible for doing is talking to providers and taking the information that providers submit, and they determine and report to CMS, what the expected per member per month payment is. And then CMS, of course, is financing this with a per member per month payment to those organizations, and the organizations in turn use the monetary resources that are covered under per member per month to pay out to provider systems who are billing them. And so that's what a managed care organization is doing.
Thank you. And do you have a feel for states like Minnesota, where the managed care organization rate is higher than 75%, or the managed care enrollment rate is higher? What is the other 25%? Do you know what that is?
Yeah, that's a good question. Because typically, managed care organizations it's some other, entity, some other group, a private insurance provider or a county, acting as this managed care organization. My guess, and I don't know this for sure because so much of the work we do, we basically don't even look at the fee for service, but it could be that somebody is enrolled or covered under just a state conventional Medicaid fee for service arrangement because there's no managed care organization available. But even in areas with heavy managed care organization penetration, so for instance, like the Twin Cities metro area, my guess is that somebody can be enrolled in conventional fee for service Medicaid. Right now, or, if they don't happen to get picked up by a particular managed care organization. Now, I know in Minnesota, people were actually automatically enrolled after a period during the early Medicaid expansion time. So it's likely that in areas where managed care organizations were operating, they probably would have just gotten in it. So it could be people in rural areas where managed care organizations have not reached yet. It could be a few different things. But you do have, if you've got, keep in mind that managed care in Medicaid is under the waiver system. And so conventional Medicaid is fee for service.
Thank you. We have a question about the cost, particularly in the figure for Medicaid beneficiaries that are over 65. It shows the average cost of a little less than $15,000. Is it correct to assume that there are additional expenditures covered by other programs like Medicare?
Yeah, absolutely. Yeah. So keep in mind. Yeah. So keep in mind that typically if somebody is age eligible, they are going to be enrolled in Medicare, and Medicare is the primary payer for most services, with huge exception being things like long-term services and supports. But Medicare is a primary payer for most services, and so that's not to say that that's the person's whole per capita spending or something like that.
Thank you. And then we have a comment and a question. It looks like the data make it clear that to understand Medicaid managed care, we need to focus on more, or at least as much, on expenditures rather than enrollment. Do we have any charts or analysis about managed care coverage of behavioral health and disability groups?
We don't. I don't at the moment.
This is one where I would say, yeah, if other participants are in this space and have some resources, please feel free to share those, but we can definitely look into it for you as well. Yeah.
Yeah, and you could check into like MacPac too. That might be a good place if you're breaking down into really specific, coverage groups or service categories. You could check there too. But yeah, if other people have other resources, absolutely.
And we have time for a few more questions. So if women become pregnant and then are eligible for Medicaid, do they receive coverage from retroactive eligibility?
So this is one where I would be fuzzy. I believe that they could, but I believe that if, especially if a person who is going to give birth is receiving any kind of prenatal services at all, I would expect that health systems would probably try to get them enrolled. At least from what I'm familiar with. Now, this may be very different for other states where enrollment is different or other things. Typically, especially systems that see a lot of Medicaid patients, safety net systems and so on, they're usually, they usually work hard to get people enrolled if they can. And so I would expect that in a lot of cases, it's not due to retroactive enrollment. I suppose it could happen, but I am not aware of the degree to which that happens. And so I think it's possible, but from what I've seen, and this is common, we've seen like county data, for instance, where we see children enrolled pre-birth in the enrollment data. So obviously that's where the parent, the person who's giving birth is going to be getting covered and getting that coverage going prior to the birth itself. So I do think, generally speaking, health systems and providers would be trying to get that person covered prior to the birth.
Thank you. And then we have a question about, do we see complete clinical encounter data for managed care in Medicaid data? I think you talked a little bit about that, but.
That is, so again, we'll look at some resources later. I would say that my best guess would be not a complete set of information. The degree to which we get all of the information is going to vary a lot, and that could vary not just by state, but you could imagine also provider systems that are a better resource to provide full information when they're billing, who have better billing departments or who are able to contract with a good billing service. They may be putting more information, supplying more information to the managed care organization. So I would expect it actually to even vary at the level of providers. But overall, state systems are, I would assume that you're going to see some variation in the completeness of information that we get from encounter records in the Medicaid data. The only thing I would say is that with TAF, I do believe that Medicaid has done a lot, or CMS has done a lot of work to help greatly improve and help ensure better data quality and better submission practices. So compared to historically, I would expect that the information is more complete. But again, it's going to vary a lot, and there are resources you can look at to get kind of at least gauge a sense of how well and how completely information is submitted to CMS.